You would think there wouldn't be anything unexpected about recovering from one of the safest and most effective surgeries of all time. But as a physical therapist, I've seen some pretty consistent areas that my patients aren't expecting after a hip replacement. So let's make sure you aren't in the same boat. Hello and welcome. I'm Dr. Heather, and I have over a decade of experience as a doctor of physical therapy helping people understand and recover after hip replacements. So if you're thinking about hip replacement surgery or already have one on the books, let's talk about the things I've seen as a physical therapist that can make your recovery as fast and easy as possible. I'm going to go over things to expect with movement, but also some things PTs know that can make your general recovery easier, like with pain and swelling. At the end, I'll have a few extra tips that can help keep you organized during recovery, because sometimes it can get overwhelming. So definitely pause the video and rewind if you need to, and always feel free to ask questions in the comments. Let's start on the day of surgery. Early exercise might not be something you expect after surgery. Some of my patients definitely thought the day of surgery was only going to be for resting. But early movement plays a part in reducing complications and making recovery faster. Plus, it keeps your hip from getting stiff with swelling. So you'll probably hear the phrase, "motion is lotion," from your physical therapist a lot. Your PT won't ask for anything crazy that first day though, just some simple exercises to get your leg moving. And by simple, I mean sliding your heel on the bed and pumping your ankles. You can do that. And how do these small movements actually help? Some people can be scared to move after surgery because they don't want to mess up their hip. I've seen exercises like this kind of break the ice mentally and act as a way to sort of introduce the body to the new hip and show your brain that moving it is actually okay. And those ankle pumps, they're also a little movement with a big payoff because they get the natural pumping mechanism in your calves to actually push out swelling and help lower your risk of complications from blood clots. Even though it's not the exact same situation, patients who exercise on the same day as their knee replacement surgery drop their risk of blood clots 30-fold. Pretty cool, huh? So pump away on surgery day. Now that you know you're going to need to go and move on the first day, let's make sure your recovery doesn't get a big setback from overdoing it. Okay, this may be surprising, but your body isn't going to hurt right away when you move after surgery. Remember, your hip just got through getting literally cut and beat up in the surgery room, and it needs to be treated nicely. But the anesthesia and pain meds after surgery can be so good at keeping the pain away that it might not actually feel like anything happened to your hip. That means that even though your hip feels good when you're up and walking, that movement is still working the surgery leg. And just like when you eat something that upsets your stomach doesn't hurt when you eat it, right? It's later that your stomach feels bad. It's the same with your surgery. Later, your hip is going to tell you with pain and swelling that it did not actually feel good while it was moving. Because of that, it's pretty common for patients to do too much and then feel like they have a setback. It can happen at any point, but for a variety of reasons that all come together around that third day after surgery, that can be a really common time to experience a setback. So arguably, the most important thing you can do right after surgery to avoid setbacks is to go slow. Go slow. And even knowing this is a thing might not be enough to prepare you for how really, did I say really? Easy it is to overdo it after surgery. Now, I know we've just talked about how you need to go and move the day of surgery, right? So does all of that change now? No. You do need to go, just go slow. Your PT will help a lot with this and will give you instructions on when to start new exercises and how far and how often you need to be walking. So your job is to walk, literally, the line between enough and too much movement. You can do that by sticking to the plan your PT gives you. Most structured walking programs will start with something like 2 to 3 minutes of walking every hour while awake. That includes trips to the bathroom. That's not a lot of walking, but it is walking. Your walks will get a minute or two longer every few days, but your activity needs to match where your muscles are in the healing process. And overdoing it means pain and swelling and setbacks for your recovery. So make sure to turn off your no pain, no gain mentality before surgery. Once you get through the first few days of recovery, ramping up activity slowly still keeps away setbacks. This goes for about the first year after surgery. Your hip can still get painful and swollen by overdoing it. So what will you do? Go slow. As a side note, Even sticking to the walking program, but not using a walker, can be a source of overdoing it. The walker is meant to take weight off the surgery leg and let the bones and muscles heal before working at full strength. Even trying to limp or take a few steps without the walker means using that leg more than it might be ready for. And I can see some of you thinking about hopping.
Right to jail, right away.
Please just use the walker. And there's really no rush to get rid of the walker either. Because it helps so much with practicing a normal walking pattern, I encourage my patients to keep using it until their walk is completely even with no limp. I see this as a win by protecting the hip as it heals, avoiding setbacks, and practicing a normal walking pattern all at the same time. So push that walker with pride. You put a lot of time and effort into that hip replacement. Before we move on, I do want to touch on an experience that several of my patients have had, and that there's also a chance you may experience as well. If you are one of the people who stand up after surgery and it feels like your legs aren't the same length, what does that mean for you? Leg length discrepancies can definitely feel like the worst kind of unexpected surprise. Your surgeon is going to do all they can to make sure your legs are the same length. That being said, a relatively small difference is possible and sometimes even helps make sure the new hip works right and stays in its socket. This is a risk you and your surgeon should talk about during your visits before surgery, but it's important to know that feeling like your legs are different is not necessarily because they are different. Even when both legs are the same length, after surgery, the new hip can pull on the muscles and tendons, which communicates to your brain that it feels like the legs aren't the same. Fortunately, muscles and tendons are pretty good at stretching, so in most cases, that feeling goes away as the muscles adjust. So if things feel tippy, keep calm and communicate what you're feeling with your surgery team, because keeping your team in the loop on any surprises is important. That's what they're there for. Try to keep this in mind for the next points too. Your team wants to know if there are things you're struggling with in your recovery, so don't be afraid to give them a call. And I've seen firsthand how the right team, as well as the right knowledge and mindset before surgery, can drastically improve outcomes. That being said, I'd like to know what you see as the biggest hurdle in recovering after a hip replacement. Let me know in the comments. So far, we've talked about a lot of movement stuff, about how you might have a false sense of feeling good after surgery, and how to avoid setbacks. But reality is, even when you're super careful to avoid overdoing it, your hip might still feel side effects after surgery. I mean, your hip did just go through a lot. So let's move on to some other stuff PTs are really good at, helping you manage pain, swelling, and the healing process. Managing your pain is a big part of recovery. Your surgery team nurses and therapists will be a phone call away and ready to help if you struggle with keeping the pain under control. Your surgeon will fill you in on what medications you'll have, as well as things like ice and sticking to your walking program. You can also take a look at the American Academy of Hip and Knee Surgeons Pain Management Strategies for Hip Replacements, which I have linked in the description. One of the most important things to remember with pain medication is to stay ahead of the pain. Like we talked about with walking, just because you're not feeling pain doesn't mean your hip won't be hurting when the pain meds wear off. Your nurse will give you instructions on how often to take your medications after surgery. Talk to them about timing your doses so you can sleep through the night without pain waking you up. And try timing your exercises for when your pain meds are working at their best. Ice can also be really valuable after surgery because it helps to manage pain without medications. This might be important if your surgeon needs to limit your doses for whatever reason, or to avoid the side effects from pain meds. But the ice packs do need to be really cold to get that full benefit. How often you will need to ice will change as your hip heals, but it could be as often as 20 minutes on, 20 minutes off, 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 20 minutes. Now, some of my patients do fine with rotating 2 bags of frozen veggies, but for most, they feel better with a more substantial ice pack option. The type of cold pack in most PT clinics is going to be a gel pack, which generally gets colder and holds on to temperature longer. This is the kind I have in my freezer. The downside with all ice packs is that when you sit on them, they tend to warm up pretty quickly, and they can take a while to get cold again. To make sure you've always got one ready to go, beef up your cold pack collection before surgery to at least 3 or 4 cold packs to rotate through. And I can't talk about icing without saying to always put at least a layer of clothing or a pillowcase between your skin and the ice. And ice exactly as long and as often as your instructions say. It might be tempting to try to get as much cold as possible into your leg, but adding frostbite to your recovery is not a good plan. Most people also assume that ice is only for the first few weeks after surgery, but anytime your hip hurts or swells or you think you might have overdone it in the first year, 20 minutes of icing will work just as well as it did right after surgery. Another after-surgery side effect you'll be combating is swelling. Swelling has surprised more than a few of my patients by not showing up in the first couple of days and then, boom, sneaking up on them again around that third day after surgery. Especially if you're feeling pretty good and thinking, I don't need to do so many of those ankle pumps, elevation. Your body just might surprise you with a big old poofy leg. No one wants that. One of my patients had so much swelling that his leg had nearly doubled in size from his hip to his toes. That meant a lot of fluid was stuck in his leg, not moving. And that's the kind of situation where blood clots are prone to develop. So we combat swelling by elevating the leg using some thick pillows or cushions. This lets gravity, which is usually pulling fluid into the leg, actually work in our favor by pulling fluid out of the leg. To get the best bang for your buck with swelling, the recommendation is to elevate your leg above heart level. That doesn't mean to get your hip above heart level though, just the leg. Your knee is a pretty good benchmark. My patient elevated his leg at around a 45-degree angle for most of a full day, and it was almost back to normal size by the time I saw him the next day. Most of the time, a full day of elevating is way more than you'll need, and most of my patients end up doing it for 20 to 30 minutes at a time, 3 to 5 times a day. This is usually enough to keep the swelling under control and is a little easier to tolerate for most people. Another tidbit that may help after surgery is for a couple of weeks to keep your leg propped up anytime you're sitting. The idea is to keep gravity from having a chance to pull those fluids back down into your lower leg and work against all that elevation you're doing. Another side note, your hip will get pretty beat up in surgery and will probably turn black and blue from bruising. That's okay, it's totally normal, and the ice and elevation you're already planning to do will help it go away. But that does bring me to our last thing. Some people have no issue actually seeing the side effects of surgery, but for others, it's got a big ick factor. But looking at the incision is something someone will need to do. And not just a quick look, but tracking changes like new drainage and signs of infection every single day. Fortunately, most of us already have a great resource to help with this. And whether you're squeamish and need to grab a buddy to help, or are totally at ease with this idea, one of the best ways to keep track of changes is to get a daily photo. You'll have a record of your healing and a resource for your medical team. So what are you looking for? At first, the incision is going to be covered by a bandage. Usually it's waterproof to seal the incision in, and the only thing you'll look for is dark spots from leaking fluids. This bandage is great for preventing infections straight out of the surgery room because no germs can get in. But just like leaving a Band-Aid on too long, the skin will eventually get wet and wrinkly. We call this macerated. And macerated skin is the perfect situation for an infection. So after about a week, that bandage has to come off. Infections are easy to treat if they're caught early. In your daily pictures, look for signs of infection like extra redness or oozing. And if you notice changes, your medical team can use your pictures to identify problems and act quickly. When the bandage comes off, the incision will be healed enough to keep most germs out. But you can keep germs from even getting near the incision by keeping hands, lotions, and pets away. Also, you want to be gentle and still protect it some, so avoid scrubbing the incision and pick out clothes that won't catch as you move. For my patients, wearing underwear with a smooth fabric and loose clothing with an elastic waistband has made everything a little more comfortable. Now, you might have gathered from all this that there are a lot of instructions that go into recovering from a hip replacement. It can start to feel overwhelming because some instructions will even change every few days as you heal. It will feel confusing. It will feel frustrating. You will just want to wad it all up and throw it out the window. But following instructions around your movement, exercise, medications, swelling management, and incision care are the way you control your hip replacement success. So take time now to prepare for how you'll handle those feelings and to come up with a strategy to keep track of the instructions. Your medical team will help you keep on track, but a couple of ideas that have worked for people in the past include medications. Have a log or notebook with daily checkoffs to keep track of doses for your surgery meds and any regular meds. Sometimes regular medications need to change for a while after surgery, and this helps keep everything organized. Exercises. Get pictures of exercises from your PT and do your exercises at the same time every day. Find a way to reward yourself for doing the exercises, even if it's just a satisfying checkoff after every set. Walking, ice, and elevation. Bundle these together by always icing and elevating immediately after walks. It's not cheating to use your resources to feel better after doing some work. The whole process of a hip replacement is a process, but knowing what to expect with your movement and healing after surgery will give you a big leg up in your recovery. And by watching this video and preparing now for your hip replacement, you're setting yourself up for a future where your recovery is successful and you're back to doing what you love. And you can always ask your PT and the rest of your surgery team if anything unexpected pops up. Let me know in the comments if this video helped you feel more prepared before surgery. I'm also working on a few more videos around hip replacements, so make sure to let me know if there's anything specific you'd like to know before getting one. And as always, if this video has shown you something new, make sure to like, subscribe, and let me know in the comments. Thanks! Bye!